This portion of the show looks at the problems facing our nation and how they affect our medical system. I'll speak with Dr. Bonati regarding his concerns for the high healthcare cost and the doctors who are forced to work through the red tape of the insurance companies. Also, is it a conflict of interest that the American Medical Association offers health insurance when it's supposed to represent the welfare of the doctors and their patients? Let's find out. Dr. Bonati, one of the other topics that you're always so fired up about is the fact that insurance companies are the reason that insurance premiums have skyrocketed. And I was just reading an article where they said of all industrialized nations, the United States is the only one that allows insurance companies to dictate price, remove health care from certain people, deny coverages. What do you think about that?
This is another problem that I believe that is the responsibility of any type of abuse is when you let the people or the industry or the business abuse you. So I don't understand why we complain about the insurance companies, because the insurance companies, they are looking at the doctors and they're laughing. They're saying, such a bunch of idiots. Because they set the price and they lower the price and they change the price and they change the rules, and it's no defense mechanism, is no response from the physicians. And the mechanism of defense that we have in the past was American Medical Association. The American Medical Association is responsible to treat and to protect the doctors. They work with insurance, so they have an insurance company practically dictating them how to do these things.
Isn't that a bit of a conflict of interest to have the American Medical Association, who's supposed to be a representative for surgeons, even though they only truly represent about 17%? They're supposed to be looking out for the best interest of the doctors, not the best interest of their own pockets or insurance companies.
Well, the problem is we let that thing happen, okay? And still physicians cooperate with American Medical Association. They need to understand that meanwhile you continue supporting American Medical Association to be a system that does not protect doctors against the legal system, against the insurance system, against the politicians, then they are going to lose medicine.
I also saw in this story that the increased premiums that they're charging are not allocated to the actual patients who need it for their health care. It's actually going to pay administrative costs, like CEOs, and to line their pockets. How can that be?
They are taking a tremendous amount of additional employees. In the last 2 years or so, the industry of the insurance beef up their working force and almost 50% of more employees. The idea is to control the physician and they lower the prices and they beat the physician to death on the approvals of their acceptance to treat the patient. One of the problems that I see is that the patient arrives here and then they said 1 to 5 days to approve your surgery. That means that this patient has 2 procedures or 3 procedures that needs to be done. Patient is to be here 3 weeks. When you ask a patient to stay 3 weeks here, not only is a horrendous inconvenience, it's also horrendous expenses, because they need to stay in a hotel, they need to abandon their job, and it's a lot of things that go with that waiting time. The insurance companies just don't care. They do that in their benefit, and amazing that the people allow this to happen.
Well, thank you for watching American Medicine Today. Remember, you do not have to live with back pain no matter what another facility may have told you. There is an option. Stop suffering and seek a consultation to see if the world-renowned Bonati Spine Procedures can help you. If you have any comments or questions, contact us at the number below. You may be featured on an upcoming program. You can tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We would like to hear from you.